everybody. Good evening. My name is Elisa Aguilera, and I am the co-executive director at Vocal New York. And I'm so excited to welcome you to Vocal New York's Caring and Compassionate New York City Mayoral Forum. Welcome to everybody watching on the live stream and to our listeners on WBAI New York. I'd also like to introduce my co-moderator for tonight, Jawanza Williams, Director of Organizing here at Vocal New York. And together, we're going to welcome 8 of the leading candidates for New York City Mayor. Sadly, Carlos Menchaca had to drop out at the last minute, but we're still going to have a very important conversations about how the next mayor will tackle some of the most pressing issues impacting marginalized communities in our city. Before we get started, I wanted to take a moment to share a little bit more about Vocal New York, who we are, and why we're having this forum here today. For the last 20 years, Vocal has been building a movement of low-income people dedicated to ending the AIDS epidemic, the war on drugs, mass incarceration, and homelessness. Every day, we fight for systemic change rooted in justice, compassion, and love. We approach our work with a firm belief in reducing harm and ending stigma, and with the knowledge that the issues impacting our communities are not driven by personal failings, but rather by institutional oppression. Above all, we work with the knowledge that abolishing systemic poverty and injustice will only be done by building the leadership and power of the most marginalized among us. Many of you know us from our campaigns, our protests, our rallies, but I also want to lift up our work as care providers. As an organization that was created in response to the AIDS epidemic, we know that sometimes we are the only ones that are able to keep each other safe. That's why it's so important that we operate a syringe exchange in Brooklyn, where we work every day with people who use drugs, people who are living on the streets, people who are stigmatized and criminalized every day of their lives. And we meet them with compassion and care, whether that's providing sterile syringes, teaching people how to use naloxone, or helping them get cured from hepatitis C. These are the things that we do every day and we see every day at Vocal New York, and that informs our activism, our organizing, and our theory of change. And we know that things aren't working. We need more resources. We need to invest in the tools that actually keep people safe and alive. Housing, healthcare, mental health services, harm reduction. These are the things that will bring safety into our communities. These are the things that will create healthy lives. And sadly, so much money, more money is going into policing and incarceration because people believe that the things that our communities and our members are doing should be criminalized. They don't want to see it. And really, what we want to do tonight is shine a spotlight on these issues and say we're not going to solve these problems by pushing them to aside. We need to center them. We need to center the lives of people directly impacted by HIV, drug use, incarceration, and homelessness. And together we can build a city that is truly caring and compassionate for all. And to this end, we released a report earlier this week, and Jawanza is going to talk a little bit through this report that's really going to serve as the framework for our discussion. So Jawanza, go ahead.
Thanks so much, Elisa. Again, my name is Jawanza James Williams. I use he, him pronouns, and I'm the director of organizing at Vocal New York. And it's an absolute honor to facilitate this conversation and to be reaching out in the names of the most vulnerable New Yorkers across our city. First, it's really important that I acknowledge we are deeply disturbed and enraged by what appears to be a white supremacist attack on Asian communities, notably against women, in Atlanta yesterday, reminding us that racist violence often has anti-woman dimensions. While we aren't here to pretend that we have all of the answers to cure the hate and violence in our world, it is our collective responsibility to respond. As anti-Asian sentiment continues to grow, so must our commitment to center and protect vulnerable communities. And that does not mean more police. I have to say that right now. And we at Vocal New York stand in solidarity with Asian communities in New York City and across the country, across the United States. And our thoughts and prayers go out to the people directly impacted by this horrible tragedy and those dealing with the psychological fallout of this most recent period of anti-Asian sentiment. So as Elisa noted, yesterday, Vocal New York released our Caring and Compassionate New Deal report, which we're very, very excited about. So essentially, we asked ourselves, is a New York City without homelessness possible? Is a city without drug overdose deaths unrealistic? Could our city function without jails, prisons, and a criminal legal system based on racism, classism, and punishment? The Caring and Compassionate New Deal for New York City is based on a simple premise. We can address poverty and public health concerns by providing people the services and care they actually need, not by relying on policing and incarceration. We believe that is possible, and the Caring and Compassionate New Deal report is our collective response. It's not a roadmap for achieving this vision. It's a call to action. It demands that we stop trying to push aside issues of homelessness, substance use, mental health care crises, and criminalization and incarceration, and instead work towards permanent, bold solutions to eradicate these problems. It dares our elected leaders and the public to completely reimagine the role of city government and its methods for delivering social services. It recognizes and harnesses the potential and humanity of the hundreds of thousands of New Yorkers who have fallen into marginalization and are quietly struggling. We see you at Vocal New York, we hear you, and we are here to protect and uplift you. So some primary components are a restructuring of the city government, the permanent removal of law enforcement, courts, and jails as it relates to homelessness, substance use, and mental health care crises. And of course, a historic annual investments in housing, social services, and care. That nothing about this moment that we're dealing with because of COVID, because of the last 4 years of totalitarian rule coming out of Washington, D.C. through the Trump administration. Now is the time. Arundhati Roy, a famous writer, said in the early days of the pandemic that perhaps COVID-19 is a portal. It's an opportunity for us collectively as a people to decide to do something vastly different. She's asking us, will we drag the carcasses of our racism, hatred, of our failed policies that lead to mass homelessness, to mass overdose deaths? And are we going to instead leave those things behind and step towards a future, an egalitarian future, where there is no homelessness, where there is no overdose deaths, where there is no anti-Black racism, where there is no anti-Asian racism? That's our opportunity, and we understand that we cannot solve all the things, but we know that our city government can be structured in a way that responds to the nuanced realities, the complexity of these racist, classist states. Elisa?
All right. Thank you, Jawanza, for that powerful intro, for grounding us in why we're here today. The stakes are high, and we're going to ask the hard questions, and now we're getting into it. So basically the way that we're going to frame this is we are breaking it up into 3 chunks. We had 9 candidates, but as I mentioned, Carlos Menchaca unfortunately was not able to join us today, so it's just going to be 8. And so the first panel is going to be with Ray McGuire and Scott Stringer. And then the second panel will be Wiley, Kathryn Garcia, and Shaun Donovan. And then the final panel will be with Dianne Morales, Andrew Yang, and Eric Adams. So we hope that you can stay tuned for the whole event. If not, we'll put this up on YouTube and you can watch the whole thing later. So Jawanza's going to moderate our first panel. And Jawanza, we'll kick it back to you. Good luck. And I know I'll be looking forward to watching the conversation.
All right, so first we're going to bring up Mr. McGuire. Hi, Mr. McGuire, welcome. Thank you for being here.
How you doing? Thank you for having me.
It's an absolute pleasure. And I think we're looking for Mr. Scott Stringer. Uh-oh. Oh, he's not here yet. So I think he's wrapping up on another forum. But Mr. McGuire, if you want to say a couple of words about yourself for the folks that are listening right now on WBAI Live and also on YouTube and Facebook.
First of all, let me applaud you for holding this forum. Second of all, let me add to the chorus of standing against the crimes that have been increasing against Asian Americans. That reflects that for which we should have zero tolerance, and we should stand up and be visible in our outrage against this kind of activity, which is an encroachment on all of that for which we stand that is right. And I want to be clear about where I stand on this, right, clear, and unequivocal. At each instance, we ought to stand up and declare that it is unacceptable. We find it abhorrent, and we find it totally against anything for which we believe. So I am Ray McGuire, and I'm running for mayor. I'm running for mayor because of my lived experiences what I've been able to experience while I've been in New York City, what I've been able to contribute and receive from this great city, the one that I love. And I come to this with a sole focus on making certain that the best days of New York City are ahead of it. I have a plan about which we'll talk tonight, which is the economy. Go big, go small, go forward. It is safety and justice, and it's education. And it's based on that we will move forward. And I will tell you that I'm in nobody's pocket. I didn't get termed out. I'm not looking for promotion. This is a calling for me to make certain that I can give back to the city that I love in ways that are going to be so fundamental. I don't have a press release. I don't manage by press releases. I have a proven track record of having kicked down doors, created opportunities, especially for those people, black and brown, who look like me, in an industry that was 99% people who did not look like me, probably 99.9% people didn't look like me. And I've made certain that others had the same opportunity that I have, which is what this is all about, especially for our children, especially for our children.
Okay.
So thanks for having me, and I'm open to any questions that you have.
Okay, thank you so much, Mr. McGuire. In fact, I think we're going to go ahead and start with the questions. We'll wait for Mr. Stringer to arrive, and we'll circle back where necessary. So our first question is about the Caring and Compassionate New Deal. Again, yesterday, Vocal New York released our Caring and Compassionate New Deal for New York City, which calls New York City to tackle the intersecting issues of homelessness, drug use, and unmet mental health needs without relying on policing and incarceration, but rather through a major investment into housing, social services, and care. If elected, would you adopt this framework, including removing NYPD from all responses to homelessness, drug use, and mental health crises? And if so, describe how your administration would restructure city government to make it effective. You have 1 minute.
Great question. Listen, I agree with much of your framework, although I would not commit to everything you laid out. Some places where we don't fully agree, I released a plan for safety and justice that outlines my vision, which is helping prevent New Yorkers from interacting with the justice system in the first place. We have all too many of those interactions, especially black and brown people. NYPD should focus on the serious crime on the rise, including gun violence, and have the resources and the focus to do so effectively. I would increase funding for community-based prevention programs. I'd create a 24-hour emergency social services bureau to respond to incidents where mental health or substance abuse response was needed. Sometimes often we have not responded with the appropriate proportionality. And I would increase accountability at all levels. And I would fund and empower the CCRB. For example, today it takes 48 days in order to get video cam footage. I'd make sure that occurred in 48 hours. And I, as the leader of this city, would be held responsible. I'd also appoint a deputy mayor for public safety to make certain that he was empowered to help the day-to-day management of the NYPD, which today we have delegated and abdicated. I would be directly involved, and I'd want to be held accountable.
Okay, and just as a follow-up, Mr. McGuire, thank you for your answer. What exactly don't you agree with? Is it that police should be responding to homelessness or to substance use calls?
Well, what I call for is proportionality. My emergency social services is designed to do just that. When I say proportionality, it has been said by others, if the only thing you have is a hammer, everything looks like a nail. When it comes to many black and brown members of the community, it's a sledgehammer. So I want to intervene and have the emergency social services in the precinct to respond either with or before the NYPD, especially in situations that are managing the homeless, those people who are ex-offenders, drug abusers, and also those people who are mentally challenged. We have an increasing number of those New Yorkers who are mentally challenged. And much of this existed before COVID. It's only gotten exacerbated because of COVID, which is where my emergency social services comes into play directly to intervene.
Perfect. Thank you so much, Mr. McGuire. So what we're going to do, we're still waiting for Mr. Stringer, who I think may be having technical difficulties. So we do apologize to that for folks who are watching. But first, we do have a video submission from one of our leaders in our drug users union. As you know, Vocal New York organizes 4 issue-based unions made up of people that are directly impacted by the issues that we work on: ending AIDS, mass incarceration, homelessness, and the racist classist drug war. And today we're going to be hearing on our drug policy issues from Terrell Jones, who lives up in the Bronx and is a longtime leader in the users union. So if we could cue that video, that'd be great.
Hello, my name is Terrell Jones. I am a longtime leader of both New York Users Union and the Outreach and Advocacy Program Manager at New York Harm Reduction Educators. The drug war and the overdose crisis have devastated my community. Growing up in the Bronx, I have watched generations of black, brown, and low-income New Yorkers either die from overdose or lose years of their lives to incarceration like I did. At Vocal New York, we believe that every overdose is preventable and that no one should go to jail for using or possessing drugs. We have the tools to prevent overdoses, but now we need the political will to implement these solutions that we know that will work. Take Portugal, for example. They decriminalized all drugs in 2001, and they saw a massive decrease in overdose deaths, along with decrease in new HIV and hepatitis C infections, and more people entering drug treatment. Portugal now has the lowest rate of overdose deaths in Western Europe. And Oregon just did the same. These are the type of bold solutions we need in New York City. For years, elected officials have promised us meaningful change, but all we get is more policing and more overdose deaths. We are tired of false promises. We need a mayor that's committed to fundamentally changing the city's approach to drug policy by embracing harm reduction and rejecting criminalization.
Shout out and thank you so much again to Terrell Jones, who does a lot of important work in the Bronx to keep people alive. Working with New York Harm Reduction Educators and the Peer Network of New York. Mr. McGuire, we're going to continue moving forward with our first series of questions around drug policy in New York City. So, the first question, which you have 1 minute to answer, it says, decriminalizing possession of small amounts of all drugs is a critical step to ending overdose and replacing criminalization with care. What steps, if any, would you take to decriminalize all drugs in New York City? 1 minute.
Well, the facts are we need to take a look at how this has been managed up to this point. And it's not just a monolithic way to think about this, right? So I think we need to focus on making certain that we have had the appropriate services. Need to make certain that the decriminalizing all drugs means that recognizing the difference between substance abusers who need help and support versus organized trafficking rings or doctors who illegally prescribe opioids. We need to focus NYPD and the prosecution on those responsible for the spread of drugs in the communities. So I've seen the impact of abuse on families and communities, and my priority will be to help more people avoid or cease substance abuse.
So just as a quick follow-up so I'm totally clear for the folks in New York who are listening, you support decriminalizing all drugs in New York City?
I do not support decriminalizing. It just depends on what, not all drugs are obviously created the same. So I understand the impact, and I'm going to focus on those responsible for the spread of drugs in the communities and see that. But that does not mean that we're going to decriminalize all drugs. It does mean that we need to recognize the difference between the substance abusers who need help and support versus organized trafficking rings or doctors who illegally prescribe opioids. So there is a difference. That's a substantive difference. So the answer is no, but.
Yeah, well, we'll move forward, but the question was specifically about decriminalizing possession of small amounts of drugs, not about, widespread distribution of drugs by a doctor or by some organized crime syndicate. But I'll move forward to the next question, which you'll have 30 seconds to respond to. Mm-hmm. So overdose prevention centers, OPCs, are places where people can use pre-obtained drugs under the supervision of trained professionals who can intervene in case of an overdose and link people to services and care. There are more than 100 overdose prevention centers across the planet, and peer-reviewed studies have proven their public health effectiveness. Will you direct the Department of Health to partner to implement overdose prevention centers in your first year in office? 30 seconds.
So let's be clear, around the world, starting in Australia, we've had mixed responses. You go to the Netherlands, you go to Canada, you go to Switzerland, and you go closer to home in Philadelphia. Those responses are mixed, so it's not uniform. I would direct my Department of Health to invest in whatever strategies we can employ that are proved effective to provide services and support to people and to prevent overdose. So we'll have to look into it, but you don't have a clear-cut example, notwithstanding what you've cited, a clear-cut example where this has actually worked on a consistent basis. I've looked across the world, and so we need to continue to investigate it.
Well, Mr. McGuire, I appreciate that. But you do only have to look as far as City Hall, because in 2017, the city of New York did a feasibility study about the effectiveness of safer consumption spaces, now called overdose prevention centers, and found that they are viable and that we should implement them in New York City. But I'll ask the next question. And this is a yes or no response. Harm reduction programs in New York City provide free services like syringe exchange, naloxone, care coordination, hepatitis C testing, and many other health and wellness services to people who use drugs. Will you commit to doubling the New York City Department of Health's funding for harm reduction programs and interventions in your first term?
Yes.
Okay. Moving forward, this is another yes or no response question. Despite growing recognition that the war on drugs has failed, New York City continues to be the only city in the nation with a special narcotics prosecutor, an office dedicated solely to prosecuting drug crimes. The office was created in 1971, the same year President Nixon declared the notorious war on drugs. Do you support eliminating the special narcotics prosecutor?
Yes, I support moving in that direction.
Thank you, Mr.
McGuire.
I think I think we might be having some technical difficulties still with Mr. Stringer, and I think we're trying to move him on to audio whenever we can. But I'm going to go ahead and move us on to our next policy discussion, which is about homelessness. So first, I'd like to uplift one of our most recent and powerful homeless union leaders. And again, the Homeless Union is a group of politically active people that are actively homeless or are formerly homeless, who are helping us craft our political platforms to end homelessness across New York City and across New York State. And our next speaker on video is Milton Perez from the Homeless Union.
Hello, my name is Milton Perez. I am a native of the Bronx, Puerto Rico. I am currently a guest here in Brooklyn, Brownsville, East New York. Mainly, I've been in the shelter system for over 5 years. Around this time last year, in 2020, members of Open New York came to the shelter, and from them, you learn more about the politics of homelessness, the shelter system. In my experience, I've mostly known the business of shelters. So the business with the customer, meaning us, the shelter residents, always wrong. It's a business in which most businesses run 9 to 5, and in the shelter system, from 9 to 5, they want you out of the shelter. But most of the staff is working, whether it's the caseworkers, hospital specialists, and such. During my time, I've seen nothing but barriers being put in through HRA, DHS, and various other agencies. So people are basically running around back and forth, not knowing what to do, receiving little to no information, and just mostly being confused, being lied to, being lied about. So my question to the mayoral candidate is what are you and your administration going to do to ensure that all these agencies, HRA, DHS, and such, work together with the shelter residents so that we can move forward and end this problem of homelessness that's been around for decades now? Thank you so much.
Wow. Again, shout out to Milton. And I just wanted to also make sure people heard that Milton is actively homeless. And, and I do want to give a bit more context to the question that Milton was asking before you answer, Mr. McGuire. So over 78,000 people are living in shelters or on the streets across New York City. Thousands more are sleeping on couches or living in residential drug treatment programs, three-quarter houses, or frankly, in jail. In your first year in office, what policies would you implement to put New York City on the path, not just to reduce homelessness, but to end homelessness? You have 60 seconds to respond.
That is such an important issue given where we are today and the numbers that you've cited. My vision is prevention, services, and then pathway to permanent housing. Prevention, we need to keep those with a place to stay in their homes, whether it's rental subsidies, legal assistance, advocating for additional Section 8 vouchers. Focus on people transitioning from other government programs. Those people are the formerly incarcerated. Those people who have aged out of foster care. Those people are in hospitalization. That's prevention. We need to have services. And what do I mean by services? Mental health facilities, mental health care workers, job training and placement, and child care. We need to decrease interaction with the criminal justice system and identify those providers that work, and there are a few of them out there that work, and scale them up. And then we need a pathway to permanent housing. Shorten the time that people are in shelters. We got to pursue all options, which is in my jobs plan for expanding affordable housing through quality basement apartments, accessory dwelling units, and communal housing, and build truly affordable housing. And that would be the plan that I've outlined that we would implement to begin to address a challenge that existed before COVID, but which has gotten exacerbated because of COVID. Prevention, services, pathway to permanent housing.
Thank you, Mr. McGuire. And I just wanted to just follow up really quick on this question so we have a bit more time because our other candidate is having technical difficulties. Do you think a lot about the city agencies like HPD, we believe must play a major role in solving homelessness? Do you think a lot about how to restructure city government or to make sure that it works better for ending homelessness? There's a lot of fracturedness. Do you have any thoughts about that? That Okay, thank you, Mr. McGuire. Oh, welcome, Mr. Scott Stringer. Thank you for joining us. I know you had a lot of technical difficulties. So we're in the middle of a conversation about homelessness across New York City. And I just wanted to give you an opportunity to say who you are and welcome everybody that's listening on WBAI New York and on Facebook and YouTube.
Well, I'm sorry I was late, a little technical situation, but I'm back, and it's really great to be here with Vocal to have this very critical conversation about the future of the city and to talk about caring and compassion and the issues that you've raised in your report. And it's good to be here with my friend Ray McGuire.
Hello, Scott. How are you today, my friend?
Good, sir. Good to see you.
Good to see you.
Okay, so I'm actually going to bring you into the conversation, Mr. Stringer, on homelessness. Mr. McGuire just answered the same question, but I'll ask it for you as well. Over 78,000 people are living in shelters or on the streets across New York City. Thousands more are sleeping on couches or living in residential drug treatment programs, three-quarter houses, or frankly, jail. In your first year in office, what policies would you implement to put New York City on the path, not just to reduce homelessness, but to actually end homelessness across New York City? 60 seconds.
And look, at the end of the day, that's the bottom line. We've got to end homelessness. What we've done with this administration over the last 7 years is manage the homeless crisis. We went from spending $1.6 billion to $3.2 billion. And what do we have to show for it? More people homeless, more children homeless. And this is now a full-blown crisis. What we also have to recognize is there's another 500,000 people that are one step away from homelessness. What I would do on day one as mayor is initiate my housing plan to build 40,000 low-income housing. I didn't say affordable, low-income housing units, because that's the way we're going to move people into the housing that we need. 30% of homeless people work. We need to make sure that they have apartments. I would create the opportunity for vouchers to be at the actual cost of what it takes to rent an apartment, $2,000 at the base. And finally, we've got to take our city-owned land, and instead of giving it to luxury developers to build affordable housing, my plan is to use that land, give it back to the people, and allow community-based organizations with a redirected subsidy to build the housing we need. Right now, our plan over the last 7 years was to build housing that was not affordable. And that's why we have a homeless crisis. And that's why we have to do things differently come January 2022.
Thank you, Mr. Stringer. So we're going to move back to the second question, back to Mr. McGuire. It's 30 seconds, by the way. In order to meet the immediate needs of the most vulnerable individuals sleeping on the streets, the city must provide an adequate supply of emergency on-demand housing called safe havens, including for people who use drugs or are struggling with unmet mental health needs. If elected, would you guarantee access to non-congregate safe haven beds for every person that is living on the street that needs one in the first year of administration? 30 seconds, Mr. McGuire.
So I am fully in support of safe havens and expanding access to them. However, Both safe havens and shelters are a stopgap. My plan, as I've outlined before, is focused on moving people into permanent housing.
Thank you, Mr. McGuire. Mr. Stringer, same question.
Well, I believe that we have to do everything we can to provide every resource for people who are homeless. Right now, we are having some staggering issues at the same time. We have people who simply can't pay rent, so we have to deal with that issue. But we also have to think about how we're going to move people into the shelter system and make sure it's safe. 41% of the new people coming into homeless shelters are there because of domestic violence issues within the family, women and children. And when I've done the audits of these shelters, it's heartbreaking. I've found recently that for children 0 to 3, we've had cribs found with mice droppings, cribs next to heaters. So yes, we have to provide the shelter and the real opportunities, but we also have to move people while they're in shelter to serious safe places. And we don't have that right now.
Right. Thank you for that, Mr. Stringer. I just wanted to say for both of you, thinking about homelessness, we got to remember our single adults also that are homeless. Of course, we all know in 2019, over 100,000 students in New York City went to school from a shelter. I mean, it's a crisis of unimaginable proportion that's happening right now in our faces. And so it's really important that we all get, our heads around this massive issue and collectively respond. But I do want to move on to a question specifically from the Coalition for Homeless and Runaway and Homeless Youth. And their question is, and it's a yes or no response. 16 and 17-year-olds just won the right to shelter in the DYCD system. If you become mayor, will you grant a right to youth shelter to all youth up to age 25? Mr. Stringer?
The answer is yes. And we have to keep in mind that, children are still children, even in their 20s. And a lot of kids, especially in the LGBTQ community, who are homeless do need these supportive beds. And a lot of younger people are going into the shelter system and need to stay there because the rent is too unaffordable because we haven't built the supply. So we have to do everything to capture the most vulnerable people, the most vulnerable population. And I would certainly support 25 years old.
Right. Thank you for that. Mr. McGuire?
Yeah, I listen, I support the right to shelter, but I need to understand what you're recommending here. Are we talking about housing 16 and 25-year-olds in the same shelter? All youth or specific population like LGBTQA+, or youth aging out of foster care?
It would be upon the Department of Youth and Community Development to determine how to safely house older youth up to the age of 25. But the question is simply asking, are you open to committed to making sure that young people who are experiencing homelessness, who are oftentimes experiencing homelessness for a number of years at a time, to be able to access youth-specific services, which have a whole gamut or range of services, including trauma-informed care and wraparound mental health care services for young people experiencing homelessness. And we also understand that LGBTQ youth experiencing homelessness, is the greater proportion, disproportionately impacts, in particular, Black trans women.
Perfect. I'm sorry.
Go ahead.
Yeah, the answer is yes. I'd be in favor with those specific safety provisions in place.
Perfect. So thank you. I'm going to pop back up to our drug policy session, which Mr. Stringer missed. And I want to ask one of the questions just because it's very important. And you'll have 60 seconds, Mr. Stringer. Decriminalizing possession of small amounts of all drugs is a critical step in ending overdose and replacing criminalization with care. What steps, if any, would you take to decriminalize all drugs in New York City? 60 seconds.
Well, I think we have to come to terms with the fact that when people have a drug issue, the truth of the matter is, this is not when you take the handcuffs out. We need to provide places where people can get the services they need, the help that they need. We need to make sure that there's opportunity for whether it's morphine or different drugs. We can't just simply incarcerate. That's what we did with the Rockefeller drug laws. Look, I would disband the Special Narcotics Office. That was put in place back in 1972 in response to Richard Nixon's war on drugs. Many of my friends who went away because they had possession or small dealing ruined and wrecked their lives. The whole issue of legalizing cannabis is about also making sure we have revenue to begin to invest in communities of color that got hit hardest by over-policing and arrests during this drug moment. I believe that safe consumption and overdose prevention centers are the future. We have to do that. It's happening all over the world. Nobody is dying. Let's be open-minded and have a mayor who's willing to upend the status quo and put those centers in place, as well as linking drugs, supportive housing, healthcare, jobs. The continuum has to be inclusive of all those things, because those silo issues have not worked in the city.
Thank you, Mr. Strinker. And I'm actually going to ask you another question. You're aware of overdose prevention centers and the concept.
Yes.
So I'm going to ask very quickly, because we're running out of time and we've got a whole other section, that will you direct the Department of Health to partner to implement overdose prevention centers in your first year in office?
The answer is yes, because I think the overdose prevention centers are something that is proven to work around the world. But in addition to the centers, I do think you have to incorporate supportive housing. You have to create jobs and services. And by creating that new paradigm, that, by the way, Vocal has led on, Vocal has talked about in the new report, I support it 100%. If we keep going down the path we always go down, what's going to happen? We're just going to put more people on Rikers, more people with mental health issues, more people who suffer from drug issues. And this is now no longer something that is not possible. This is the way we bring our people back, and we help our young people. Supportive housing, but also making sure that they can go in, get a clean syringe, do the things that they have to do to save their lives. No one wants their babies who are 25 years old dead because government could not see beyond our street corners.
Yes, thank you both for your responses on that question. I do want to move us forward to decarceration, but I do want to say about overdose prevention centers for New Yorkers that are listening. We have to ask our city government, how many overdose deaths that are preventable based off of evidence-based responses are acceptable? Is it 1? Is it 100,000? How many is it? I believe that it's 0. And safer consumption spaces, also known as overdose prevention centers, are an effective tool to get us to that 0 number and save those lives. So next, I want to move us into our conversation about defund the NYPD, about decarcerating New York City. And I want to open with, beloved member of, the community, Carl Stubbs. If we could cue that video.
My name is Mr. Carl Stubbs, and I am a leader at Vocal New York. The first time I was locked up, I was 12 years old and sent to Spofford Youth House in the Bronx. I spent the next 20 years going in and out of jail, mostly committing crimes because I couldn't find a job and needed a way to provide for my family. Today, I am 69 years old, still living in poverty. I wonder what my life would be like if the money used to arrest me and lock me up was instead used to support my education and help me get a job. I don't want the next generation to go through what I went through. There always seems to be money for police, but never any money for housing or education or good paying jobs. I want to live in a beautiful neighborhood where everyone has what they need to survive. We need the next mayor to cut the NYPD's budget and invest in communities.
Wow, thank you so much, Carl. Always an honor to hear him, but we're running really rapid on time, so I'm going to ask these questions real fast. So first to you, Mr. McGuire. Every candidate has expressed a commitment to reduce both the NYPD budget and the scope of work the NYPD is responsible for. We want to hear specifics. How much would you reduce the NYPD budget by, and how exactly will that money be used to address social problems and make our communities safer and healthier? 60 seconds.
So it's easy to say that I would reallocate the funds within the NYPD by a specific number. And I hear what people are saying. It's $1 billion. They've been saying this for years. What I can tell you is that my commitment is to ensure the police funding isn't going to useless programming, harassing young people by putting officers in schools, or over-policing in certain neighborhoods with exorbitant fines and fees that are extracting wealth from Black and brown communities, and put people in contact with police when they don't have to be. And that experience is more likely to be harmful. Instead, my budget would be directed at reducing the violent crime, keeping the neighborhood safe, and changing the culture of policing for once. Respect, accountability, and proportionality. Emergency social services, returning to community policing, police athletic leagues. I've talked to Black mothers in Brownsville who are worried about rising crime, faith leaders and clergy in Southeast Queens who want to return to community policing, and relationships with local precincts that drove the crime down in the first place. I've spoken to the educators of the small business owners in the South Bronx who partner with the local precinct to support jobs for youth and after school and weekend programs.
Thank you,
like
Mr.
the Police Athletic League. So it's not cut and dry. And yes, I would reallocate the budget.
Thank you. We're out of time for that. So same question to you, Mr. Stringer.
Well, look, as the citywide elected official in this race who serves as controller, I get to crunch the numbers. And during the fight at City Hall on funding issues, I sketched out a 4-year plan to cut $1.1 billion as a baseline. And what we would do specifically is invest in programs that keep kids away from the criminal justice system. But we also have to think about what the job of the police department is all about. And for me, that job does not include responding to mental health calls. To me, that does not mean responding to quality of life calls, because that's when the police and the community interact, and these police officers are simply not trained to do that. I would model my administration's response to 911 calls after Eugene, Oregon in the Cahoots program. I would build out guidance counselors and mental health experts to respond to those mental health issues on the streets. By the way, in the Cahoots program, 24,000 responses by mental health providers, only 150 times were the police used. We are lagging behind in our community safety plans.
We got to leave it there, Mr. Stringer. Thank you both for those responses. And so the second question, back to you, Mr. McGuire. Every candidate has agreed that closing the jails on Rikers Island is an imperative. Each candidate has also expressed different concerns about the current mayor's plan, which includes the construction of 4 new borough-based jails. Where does the current administration get it wrong, and how will you guarantee that the jail on Rikers will close? 60 seconds, Mr. McGuire.
So I have 89% of the population at Rikers is Black or brown. I am for closing Rikers, but I'm not for building 4 jails for Black and brown people. 80% of have no GED, a third of which 18 to 21 do not read past grade 5 level. 88-year-old facility, the largest detention center in the world. I am not for building jails for black and brown men and women. We need to find a restorative justice approach to this. We see it in Norway. $8 billion. $8 billion is 40,000 deeply affordable housing units. No, I am not for building 4 new jails for Black and brown men and women.
Perfect. So just for clarity for our listeners, you are committed to closing Rikers and not building 4 new jails.
I am for building restorative justice centers. So we need to find a way to accommodate those who are high-level crimes, those who are mid-level, and those who don't deserve to be in jail.
Okay, thank you, Mr. McGuire. I'm sorry, I'm rushing. I'm here. I'm running out of time. Mr. Stringer, same question on closing Rikers and 4 new jails.
I was the very first elected officials to say, shut it down, close Rikers Island. And instead of putting $10 billion or even more in building these new 40-story jails and filling them with people of color, as Ray mentioned, we have to have a different approach. And part of what I believe we have to do is look at the population that's now at Rikers, first and foremost, 5,200 people, half of them suffer from mental illness. And if we really want to limit jails, the best way is to take vulnerable populations at Rikers and give the mental health support they need, give them the supportive housing that they need, and stop basically taking human beings, treating them like cattle, throwing them on Rikers Island when people know in this city government that that's not the way to go. I would create real economic opportunities for the people in Rikers to get them the services, but also
10 seconds.
Using the land use process to cobble together $10 billion in 40-story jails and communities, when we should think about the carceral movement and what it means to actually look at decriminalization, fines and fees. We criminalize poverty and more kids at Rikers.
Mr. Stringer, so just for total clarity, and we move on to the next panel. you support the plan to close Rikers, but don't support building 4 new jails.
I don't support this current plan. Look, in the utopia world, it would be great someday to say that there's no such thing as a jail. I do think we should have minimal construction to deal with the people we have to deal with, but this is not the way to do it.
I think we're gonna have to leave it there. I'll have to say personally that I do believe that it's not utopic to close jails in New York City and close Rikers. I think we can figure that out. But we're out of time, and I just want to thank you both so much for spending your time here with us and for doing the work to try to protect New Yorkers, even if we all disagree sometimes on how to exactly do that. But thank you so much, Mr. Scott Stringer, and thank you so much to Mr. Ray McGuire. Deeply appreciated. Back to Elisa.
Thank you.
Thank you, Jawanza. Thank you to our panelists. Amazing job. As you know, we have a lot of important questions that we want to get in, so we're just going to go through it. Thank you for everybody that's with us. For everybody on WBAI, you're listening to Vocal New York's Mayoral Forum. And next up, we have 3 candidates, Wiley, Shaun Donovan, and Kathryn Garcia. We look forward to chatting with you about these important issues. Welcome. My name is Elisa Aguilera. I'm the co-executive director of Vocal. I think you guys probably missed the intro earlier, but nice to meet you, and thank you all for being here with us. So really just want to start. So earlier this week, Vocal New York released a caring, compassionate New Deal for New York City. It's a policy framework. It's a call to action that really asks us to tackle the intersecting issues of homelessness, drug use, and unmet mental health needs through major investments into housing, social services, and care, not through policing incarceration. If elected, would you adopt this framework, including removing NYPD from all responses to homelessness, drug use, and mental health crises? If so, please describe how your administration would restructure city government to make it effective. And we're going to start off with Ms. Wiley.
Thank you for that question. The answer is yes, absolutely. I would start by obviously making sure that the NYPD is not getting 911 calls related to mental health crisis and intervention. We need a model like Oregon, like Jumaane Williams has championed, the CAHOOTS model, where we have crisis response teams made up of mental health professionals, as well as peer counselors, right? Folks who know how to address mental distress. We need to create supportive housing, and we need to make sure we have things like safe havens and urgent care centers where folks can go and have a place where they get the support services they need. And we have to increase the access to mental health services for those without regard to insurance. One of the things we face is 500,000 people, more than 500,000 people who don't have health insurance card. That's something we can start to solve, and mental health services have to be part of it. And in my gun violence prevention plan, in addition to a participatory justice fund where communities can direct resources to what they need and services, and I'll take that money from the NYPD, that we will have trauma-informed care also in our schools, because we know that is a critical place where we need to ensure we have mental health services.
Thank you. And so just to confirm, you are in favor of removing the NYPD from all responses to homelessness, drug use, and mental health crises. Great. Okay, and Mr. Donovan, the same question for you.
So absolutely yes, to confirm right up front. And look, I've dedicated my life to working on issues around housing and homelessness. I know that we need a totally different way to respond in this city. And so my plan calls for an alternative to 911, but it goes well beyond that as well. It really investing in the teams that we need to respond, but also creating real infrastructure for mental health care around this city. My 15-minute neighborhood proposal would make sure that every New Yorker within 15 minutes of their front door has emergency 24/7 mental health care available to them. And it would also ensure that we have a coordinated response across the city, that every time someone leaves Rikers, every time someone leaves the mental health wing of one of our hospitals, they are directed immediately through a coordinated entry system to the housing and services that they need, rather than what happens now, which is they fall through the cracks and they end up becoming homeless. And it takes months, if ever, for them to find the housing that they need.
Great, thank you. And we're going to get to lots more. I know that this is a big question and we'll dig into it. So next, Ms. Garcia, if you can answer the question.
Certainly. And so, my approach is that we need to do things that are collaborative, that I have worked closely with PD and with the Department of Homeless Services in the past. I believe that we need mental health professionals embedded with our PD to ensure that when they are responding to a mental health crisis, that they have the resources that they need. But I also believe that little children cannot be walking to school past people openly dealing and doing drugs. I've had to clean up the needles that are left behind in the schoolyard. That can't be the option that we are seeking here. And so I believe that we have to walk and chew gum, that we have to have safety as well as sympathy and compassion for those who are struggling with addiction, and ensure that we are diverting them into the services they need to break that cycle.
Thank you. And at Vocal, we operate a syringe exchange. So every day our staff go to those playgrounds, go around our neighborhood and pick up syringes. And so, I think it's important for, yeah, and I think, and just understood, and just want to uplift that, I think that, we want to have safe neighborhoods and safe places as well. And hopefully, and we believe that, obviously we believe we can do that without the police, and hopefully more investment in harm reductionist community health workers who can get that work done. So we'll get into it a little bit more. Thank you so much for your responses. And the next topic we want to talk about is drug policy. So at Vocal, we believe that ending the drug war, we, as I mentioned, operate a syringe exchange, we do drug policy campaigns. And next up, we're going to show a quick video from Terrell Jones, one of our users union leaders. So Terrell.
Hello, my name is Terrell Jones. I'm a longtime leader of Vocal New York Users Union and the Outreach and Advocacy Program Manager at New York Harm Reduction Educators. The drug war and the overdose crisis have devastated my community. Growing up in the Bronx, I have watched generations of Black, brown, and low-income New York either die from overdose or lose years of their lives to incarceration like I did. At Vocal New York, we believe that every overdose is preventable and that no one should go to jail for using or possessing drugs. We have the tools to prevent overdoses. But now we need the political will to implement these solutions that we know that will work. Take Portugal, for example. They decriminalized all drugs in 2001, and they saw a massive decrease in overdose deaths, along with decrease in new and more people entering drug treatment. Portugal now has the lowest rate of overdose deaths in Western Europe. And Oregon just did the same. These are the type of bold solutions we need in New York City. For years, legislators have promised us a meaningful change. All we get is more policing and more overdose deaths. We are tired of false promises. We need a mayor that's committed to fundamentally changing the city's approach to drug policy by embracing harm reduction and rejecting decriminalization.
Okay, thank you, Terrell. So really, it's like, how are we going to fundamentally change our approach to drug policy? And one thing we've been really inspired by is our neighbors in Oregon, or faraway neighbors, but they're neighbors nonetheless, that have decriminalized possession of small amounts of all drugs. We believe this is a critical step in ending overdose and replacing criminalization with care. What steps, if any, would you take to decriminalize all drugs in New York City? Mr. Donovan, you can go first.
So first of all, I would make sure that we have a fundamentally different approach in terms of creating safe use centers. I was the first candidate to call for safe use centers to be established here. I would also ensure, as I said earlier, that we are directly connecting those who are struggling with the housing and the services that they need. And I am certainly for decriminalizing certain substances. I would be interested in having a further conversation about whether to go as far as all of them. And the evidence in Oregon, I do have some concerns about decriminalizing completely in all substances, but we absolutely need to take a different approach to ensuring that Narcan and all of our responses, safe use centers, are fundamentally reorienting our approach.
And do you have a sense of which ones you are on the fence about and which ones you would support decriminalizing?
Well, I have seen the devastating effects of fentanyl all around this country. In my federal work in President Obama's cabinet, we substantially expanded the availability of drug treatment and Narcan and others. But I do have concerns about the devastation I've seen with highly, highly addictive and deadly drugs, where even small amounts can have life-altering consequences and even cause death.
Absolutely. Yeah. And, at our syringe exchange, we're lucky that we're able to provide fentanyl testing strips to our participants, because we know that for most of our folks, they don't want to take something that's going to kill them, right? And so we're all about how can we give people the knowledge, the tools to know what type of drugs they're using and make safe choices. So thank you for your answer. And we're going to go to the next question to Ms. Garcia. So if you could tell us your stance on decriminalizing all drugs.
So, I agree with Shaun on this one. I am for decriminalizing marijuana. I think that is absolutely fine, but there are other substances, not only fentanyl, but even things like cocaine, where you don't know how your body's going to react. And back in the day when it was super popular in the 80s, we had, young basketball players who died of heart attacks after their first use. And so saying that having a small amount is okay, for some of these that can actually kill you on the first dose, on a small dose, you don't know how you're going to respond. And so I do fundamentally believe that we need to connect people who are addicted to services, and also make more available the chemical substances that we know are helpful, Suboxone and methadone, to get people off of drugs permanently.
Thank you for your answer. And I would just, push back a little bit that, drugs have always been illegal, and the devastation and the overdose are continuing to happen. And, clearly 40 years of that hasn't worked, and we're hopeful that the next mayor will take a different approach. And so Ms. Wiley, if you could articulate your stance on decriminalizing all drugs.
Well, first of all, let me say that we have to have a public health approach to this issue. It is fundamentally a public health problem, and we have to develop and build out our capacity to respond to it that way. And that's a lot of what we talked about in answer to the first question on the platform. I would say that we have to start, obviously, with where we have already a lot of public support with marijuana, with Narcan. We have to create safe havens. We must have places where folks can go, and we must have community-based partnerships, including with groups like Focal, so that we have the ability to do outreach and increase outreach, and it should not be police officers. And we have to recognize that we've been filling up Rikers. I think 40% of those at Rikers have mental illnesses, and there's a lot of substance abuse that goes along with actually self-medicating harm. So if we're really building up our capacity to address those issues, we can actually start piloting more. I do think we have to bring and develop appropriately with the public. I believe in putting the public back in public safety, so that we're bringing people along and talking and working with community in ways that support everyone's education around safety and ensuring safety. But it fundamentally has to be a public health approach. And that also means alternatives to incarceration if someone's getting caught up in the system because they have a public health issue.
Thank you. And so our next, some of you have touched on this already. So our next question is about overdose prevention centers, also known as safer consumption spaces. And for our audience, they are places where people can bring pre-obtained drugs and use them under the supervision of trained professionals who can intervene in the case of an overdose and also link people to services and care. There are more than 100 across the world. There have been peer-reviewed studies that show that work. New York City has already studied the issue and said that there's something that we want to embrace. City Hall said something it wants to embrace. However, they still do not exist, and we don't have them in New York City. So my question is, during your first term, would you commit to implementing overdose prevention centers in New York City? And Ms. Garcia?
Certainly. And so this is one of those places where I definitely believe in overdose centers, but it is not only the mayor's decision on land use. And so my ability to commit is that I will advocate for it, but the council member in the local area is the final say on changes in land use.
Okay. And Ms. Wiley?
Yes, absolutely. You know, as we saw, we had a historic and devastating rise in overdose just in the first quarter of 2020, where we had 444 people die. That is unacceptable. And we have to actually also reform our land use policies, because we can't have the kind of NIMBYism that prevents us from making progress and ensuring that we all have what we need in this city in dignity. That includes public health, and that's a critical part of public health.
Great. Thank you all so much. So we're going to go ahead and move forward to our next. Mr. Donovan, I'm sorry.
Maybe because I already answered this question.
We know where you're at. Okay, go ahead. 30
First
seconds.
candidate to call for Safe Use Centers.
Okay, perfect. And so we're going to go ahead and move forward to our next theme. So we want to bring on a video with one of our homeless union leaders, Milton.
Hello, my name is Milton Perez. I am a native of the Bronx, Puerto Rico. I am currently a guest here in Brooklyn, Brownsville, East New York. Mainly, I've been in the shelter system over 5 years. Around this time last year, in 2020, members of Vocal New York came to the shelter, and from them, we learned more about the politics of homelessness in the shelter system. In my experience, I'm mostly known the business of shelters. So the business with the customer, meaning us, the shelter residents, are always wrong. It's a business in which most businesses run 9 to 5, and in the shelter system, from 9 to 5, they want you out of the shelter. But most of the staff is working, whether it's the caseworkers, hospice specialists, and such. During my time, I've seen nothing but barriers being put in through HRA, DHS, and various other agencies. So people are basically running around back and forth, not knowing what to do, receiving little to no information, and just mostly being confused, being lied about. So my question to the mayoral candidate is, what are you and your administration going to do to ensure that all these agencies, HRA, DHS, and such, work together with the shelter residents so that we can move forward and end this problem of homelessness that's been around for decades now? Thank you so much.
Thank you so much, Milton. And just to add a little context to that question, over 78,000 people are living in the shelters or on the streets across New York City. Thousands more are sleeping on couches or living in residential drug treatment programs, three-quarter houses, or jail. In your first year in office, what policies will you implement to put New York City on the path to end homelessness? And Mr. Donovan, we'll start with you. You have 60 seconds to respond.
So it's hard to keep my answer to 60 seconds, given that this has been my life's work. As a kid growing up in New York, I saw homelessness exploding on our streets. And I asked myself, how can it be in the wealthiest city in the wealthiest country on earth, we let our neighbors sleep on the streets? And so I started volunteering in a homeless shelter in college. I went to work for the National Coalition for the Homeless. And I had the deep honor at leading the homelessness strategy under President Obama that dramatically reduced homelessness around the country, where we really got the resources we needed and the leadership from Michelle Obama. We ended veteran homelessness in 80 cities and states, not reduced it, but ended it. So I would fundamentally reimagine our right to shelter in New York as a right to housing. As I did in President Obama's cabinet, I would create an interagency council on homelessness that would bring everyone to the table. And we would fundamentally reorient the system around housing as a right and ensure that every single New Yorker would quickly have available to them the permanent supportive housing they need and all the services to be housed, not to be homeless.
Thank you so much. Ms. Wiley, if you can answer next.
Yeah, look, housing is a human right, and we need a housing first strategy because everyone is housing ready. That does include making sure we have the supportive housing units that we need. I was really, honored and proud to have had the opportunity to speak with the men at the Lucerne who taught me so much about that, including the fact that we have to ensure that we're increasing our vouchers. You can't have a $1,200 a month voucher thinking you're going to go get an apartment in New York City. So one of the immediate opportunities we have is to make sure we raise that voucher subsidy. rather than spending $3 billion on having folks in congregate shelter, we can get folks in housing. And yes, with the supportive services they need on site. But we also have to use all our resources, and de-siloing government, pulling it together is something I did in City Hall for many things like universal broadband access. Housing has to be the same approach. It does have to be government partnering with itself as well as with our partners in communities so that we're just getting it done.
Thank you so much. And Ms. Garcia, what's your plan to end homelessness?
Right now, it is fundamentally changing the dynamic so that shelter is in the solution, that housing is the solution, and particularly for families with children, who are the vast majority of people who are homeless in the city of New York, it is about increasing that voucher so that it is somewhere near market rent, so that you can actually use it to get a permanent home quickly, because otherwise you're just spending money on a shelter that doesn't serve them well. And then for people who are street homeless or single adult homeless, there's more of a three-step process. We need drop-in centers so that they can begin to trust the providers. And then we need to move them to safe haven beds as the next step, and then into supportive housing. I mean, if somebody's ready to go straight to supportive housing, that is great. But oftentimes, in my experience, I've seen it take more than one step. But I will tell you that I have had to take away work from another agency and do it because they could not deliver food to seniors during the pandemic. And over the course of the pandemic, I delivered over 130 million meals. And today, the program I built has delivered over 200 million meals. I know how to get this done.
Thank you so much. And a few of you've referenced safe haven beds, and just for our audience, we believe that in order to meet the immediate needs of the most vulnerable individuals sleeping on the street, the city must provide an adequate supply of emergency on-demand housing called safe havens, including for people who use drugs or are struggling with unmet mental health needs. If elected, would you guarantee access to non-congregate, so private rooms, safe haven beds for every person that is living on the street and needs one in the first term of your administration? And so we'll go with you, Mr. Donovan, first, if you can answer a quick explanation.
So the answer is absolutely yes. As President Obama used to say to us, you cannot let a crisis go to waste. We have an opportunity to convert, as we've started to do at the Lucerne, hotel rooms into safe havens, but ultimately into supportive housing. And one of the things I would do, just as I did as housing commissioner, is negotiate a New York agreement with the state that would bring not just the housing funding we need, but the services that we need to ensure we're creating safe havens, but ultimately supportive housing.
Thank you. And Ms. Garcia, your position on safe havens.
All right, as I said in my last answer, I would love for the last step to be supportive housing. Some folks just aren't ready for supportive housing. And safe haven beds has to be available so that they are not on the street, and that we are not making it so that they don't have someplace safe and not be sleeping particularly during the cold and the heat.
Great. And Ms. Wiley, are you committed to making sure safe haven beds are available to anybody that needs one?
Absolutely. I was just visiting with Project Hospitality in Staten Island, who does homelessness outreach. Obviously, lots of folks who have mental illnesses and drug addictions as part of that. Safe havens is part of what they have, including transitional, and including waiting for those dang beds that people are sitting up in those shelters for sometimes 3 years because they can't get one. So I absolutely agree with Shaun on this. We must have safe haven beds, and we must be moving rapidly to get folks into permanent housing with supportive services.
Yeah. And, we work every day with people. And the one thing we know is that everybody's ready for housing, and that we want to make sure that people have a place that is safe, that is appropriate for them as soon as they want that. And so one more question on homelessness is around homeless youth. So 16 and 17-year-olds just won the right to shelter in the DYCD system. If you become mayor, will you grant a right to youth shelter to all young people up to the age of 25? And it's a yes or no. Mr. Donovan.
Yes, there's much more to say on youth homelessness around LGBTQ youth and the prevalence there, youth aging out of foster care. We have to go upstream and solve these problems. But yes, I agree on creating the right to shelter up to 25.
Ms. Garcia?
Yes, and from experience, I had a sister who was in the foster care system for 7 years, and if she had not been adopted, her aging out at 18 would have been catastrophic.
Mm-hmm. And Ms. Wiley?
Absolutely.
Great. Thank you so much. So we're going to move on to our next theme, which is around decarceration. And to frame the issue, we're going to cut to a video of our longtime leader, Carl Stubbs.
My name is Mr. Carl Stubbs, and I am a leader at Vocal New York. The first time I was locked up, I was 12 years old and sent to Spofford Youth House in the Bronx. I spent the next 20 years going in and out of jail, mostly committing crimes because I couldn't find a job and needed a way to provide for my family. Today, I am 69 years old, still living in poverty. I wonder what my life would be like if the money used to arrest me and lock me up was instead used to support my education and help me get a job. I don't want the next generation to go through what I went through. There's always seems to be money for police, but never any money for housing or education or good paying jobs. I want to live in a beautiful neighborhood where everyone has what they need to survive. We need the next mayor to cut the NYPD's budget and invest in communities.
So we know that this is a big issue. Every candidate has expressed a commitment to reducing both the NYPD budget and the scope of the work. We want to hear specifics. How much would you reduce the NYPD budget by? How exactly will that money be used to address social problems and make our communities safer and healthier? We'll start with Ms. Wiley. You have 60 seconds.
Look, I'll try to be quick because this is a big topic. So look, I've already said that I'm going to take 18 million out of the NYPD to create participatory justice funds in communities that have high rates of gun violence so that community members, folks impacted, can say what they should get investments for, what they should be used for, whether it's more summer youth jobs, although I'll double those as well in addition to those funds, more mental health services, more after school programs, but so that the community can say what it needs. I've already said that I'm going to cut incoming cadet classes and use that money for community care centers, putting also $5,000 into the pockets each year in grants for the neediest families so they can care for themselves and their families, and much more. I have also said that I am committed to putting the public back in public safety. And what I mean by that is having a truly transparent process and engagement with communities around exactly what we need to do. And that includes doing something we've never had, which is a top to bottom really real restructuring of the NYPD, eliminating things like the vice unit, but also looking at how much we should cut. I haven't given a number because it's been a black box budget. What if we could cut it $3 billion? I don't know, but I think that has to be a very transparent and public process with the public, reorienting, blah, blah. Yes, policing to what it should be, but actually making sure we have plenty of investments for what we need, including mental health services.
Thank you. Thank you so much. Ms. Garcia, the same question.
Like, certainly we need to make sure that all of our services are breaking the cycle. Like, the first time a kid shoplifts something, what is going on? That needs to be an alarm bell going off across all of our services to make sure we are addressing that and that we are diverting anyone out of the criminal justice system. However, I have said that NYPD needs to be able to walk and chew gum, that we can have both reform and safety in our communities, and that they can be focused on particularly uptick in gun violence that we have seen recently. But with that, I have to jump to another forum. Sorry.
So how are you going to close Rikers? We'll get it to you now. Are you committed to close Rikers and build 40
to close Rikers and build the borough-based jails? I'm hoping that they can be smaller jails, though, because they seem like they've gone big instead of thinking outside the box, like ensuring there's more diversion, like the Red Hook court. I think that should be expanded, and Bronx Connect, both great programs. They need to be scaled so that we are not having jail be the first resort, but the last resort. But I am supportive of getting off of Rikers, turning it into renewable Rikers.
All right, thank you so much for joining us, and we'll continue the last couple of questions with the other candidates.
Sorry, I have to jump.
It's okay. Mr. Donovan, if you could talk a little bit, how exactly are you going to cut the NYPD budget, by how much, and what are you going to do with the money?
Well, let me try and be very specific. I have committed to getting within my first 2 years to $500 million that would be diverted from our criminal justice system more broadly into community-based programs that end the cycle of incarceration. And by the end of my first term, to get to 20% of our entire criminal justice budget, $3 billion a year. Los Angeles has been the leading city in the country, getting to 10%. I think New York should do better and get to 20%. I think one of the critical things, and this is part of your caring and compassionate New Deal, we talk a lot about just the police budget, but we should recognize we're spending over $400,000 per prisoner per year in our correction system at Rikers, and we are getting terrible results. And so we need to focus on completely changing the system, moving to a pretrial agency that diverts, and of investing in the kind of solutions that actually break the cycle of incarceration. When I was the housing commissioner in this city, I implemented for the first time anywhere in the country using housing vouchers for folks coming out of Rikers. It was so successful, it's now been replicated in 40 cities around the country. Imagine what we could do if we did much more than housing, to job training and all the other services that we need.
Thank you so much. And so our next question is about Rikers. So everyone has agreed that Rikers should close, but each candidate has also expressed different approaches and also concerns with the current mayor's plan, which includes construction of 4 new borough-based jails. We want to know, where do you think the current administration gets it wrong, and how will you guarantee that the jails on Rikers will actually close? Ms. Wiley.
So look, let's start with Rikers has to close. It must. It's a big, it's just a human rights violation. And I also support renewable Rikers. We need fundamentally to have an alternatives to incarceration approach, right? First of all, we have to stop criminalizing poverty. And that's a big part of what we would transform around the NYPD, and changing both its orientation, but also taking it outside of so many things we've already discussed. But it also means that we have to recognize where and how we need, as we talked about, a public health model for mental health crisis. We have to recognize how many folks have been in Rikers for nothing but poverty. And when there has been a problem, we have to have the alternatives in place with the supportive services necessary to support folks' ability to be successful, including education, including workforce development. But we also have to have different forms of residential options for folks. And I think that's where we have to blow up the concept of jail, right? Because there are folks who either don't have a place to go back to, going back to a place gets them re-engaged in something that's created problems in the first place, and having different forms of residential options for folks, recognizing and responding to needs, means a vastly different model than what we currently have.
Thank you so much. And Mr. Donovan.
So I guess it's unanimous. All 3 of us would close Rikers and support renewable Rikers. To your question about what the mayor got wrong, first of all, he didn't embrace this soon enough. It took Melissa Mark Viverito, as Speaker of the Council, embracing the Lippman Commission to move it forward. And if we'd had a mayor who jumped on board early and was a champion, we'd be much farther along than we are today. And so that's the first thing. Second, I do think it's right that we don't need to take the current plan, and that if we do what we need to in the coming years, we could have a population that's much smaller at Rikers when it's closed and replaced. And what can replace it is something fundamentally different than what we see today. I have, throughout my career, as someone who studied not just housing, but architecture as well, believed in the power of design to rethink approaches. One of my favorite architects, won a MacArthur Genius Award in Chicago, created a police station to reimagine what a police station could look like, to be a community resource. We should do exactly the same thing with our jails. and make sure that what we're creating is restorative rather than punitive and is deeply connected to communities and to families so that we fundamentally transform the system, including the replacement jails.
Thank you. Thank you to both of you. Those are all of our questions. We're going to have to leave it there. For our listeners, we had them answer a very, very long questionnaire with many more questions. We'll make it public soon. And also check out the other candidates. So we're going to move on to the next panel. Thank you both for joining us. And also just a note to our WBAI listeners, our stream on the radio is going to end at 7 p.m., but you can continue watching us on Vocal New York's YouTube or Facebook if you want to keep listening. So now I'm just going to pass it on to Jawanza, who's going to get us with the wrap us up with the last panel.
Awesome. Thank you so much, Elisa. And thanks for everybody for continuing to listen as we try to build a New York City that works for all of us. Our next panelists are none other than Mr. Andrew Yang, Miss Dianne Morales, and Mr. Eric Adams, who I think will be joining us right at the 7 p.m. moment. Welcome, Mr. Yang and Miss Morales.
Thank you.
Thanks for having us. It's great to be here. Hi, Dianne.
Hey, Andrew.
So I'm just going to hop right in because we're short on time. So I'm going to start with Ms. Morales for the first question. Yesterday, Vocal New York released our Caring and Compassionate New Deal for New York City, which calls New York City to tackle the intersecting issues of homelessness, drug use, and unmet mental health needs through a major investment into housing, social services, and care, not policing and incarceration. If elected, would you adopt this framework, including removing NYPD from all responses to homelessness, drug use, and mental health crises? And if so, describe how your administration would restructure city government to make it more effective.
Great. Thanks for the question. Yes, I would absolutely adopt this framework because it completely aligns with the framework that I have been advocating for throughout the entire course of my race. A solidarity New York City that stands on dignity and care. I also want to thank you all for acknowledging in the creation of this, the intersectionality of these issues beyond policing. And it's still very devastating to me that the recent subway stabbings were framed by some of my colleagues in this race as incidents that should be criminalized versus being seen as a public health and transformative justice issue. As for restructuring the government, the first thing I've called for is the Morales administration would, within the first 100 days, declare housing as a human right and really ensure that every city organization and agency was focused around housing as one of the most single important physiological needs that addresses a multitude of issues that we know. The second thing is that we need money. And I've called for the defunding of the police by $3 billion. And although I know that that's not nearly enough, it's also important that bold leadership define that these talking points as possible.
Ms. Morales, we have to stop there because we're timed there, but thank you for that response. And I'm gonna move over to actually, before we bring on Mr. Yang, I think that Mr. Eric Adams has joined us. And so if we could get Mr. Adams on screen, that would be great. And okay, so we're gonna go ahead. Oh, welcome, Mr. Adams. Thank you for being here.
Hey, how are you? Good to see you. Good to see you both, Andrew, Dianne.
So just to keep us moving, I'm going to reread the question since you've just joined us, and then we're going to go to Mr. Yang. So yesterday, Vocal New York released our Caring and Compassionate New Deal for New York City, which calls New York City to tackle the intersecting issues of homelessness, drug use, and unmet mental health needs through a major investment into housing, social services, and care, not policing and incarceration. If elected, would you adopt this framework, including removing NYPD from all responses to homelessness, drug use, and mental health crises? And if so, describe how your administration would restructure city government to make it effective. Mr. Yang, you have 60 seconds.
Thank you for leading on this. I love the Caring and Compassionate New Deal because it identifies several areas in which we know New York has been falling short for years. When you have someone struggling with a substance abuse crisis or a mental health issue or homelessness, the situation does not warrant an armed police officer. And unfortunately, right now, it is an armed police officer that's showing up to many of these scenes because we've been underinvesting in mental health resources. We've been underinvesting in many of the countermeasures to homelessness, and we've certainly been underinvesting in substance abuse resources. So I love this direction. I will say that that there may be occasions when a police officer would be present, but they should not be the primary actor. They should be standing a ways away as tertiary or support staff, while someone else who's better trained to actually intervene with a person who's having an issue is leading and making sure that the issue is being addressed the right way, as opposed to having someone who's not trained for that kind of that kind of activity. Oh, sorry, I thought 10 seconds was time. My apologies, but I was just about done.
So just a quick follow-up. So just to be clear with everybody, you're saying that you think that the NYPD should, when responding to mental health crises, one, that they should be there, maybe distance, but they should be there. So their presence is something you would support when responding to mental health crises.
Not in every case, but I think the question was, would I exclude it for all of them? And the vast majority of cases would not warrant a police officer's presence, but there are some cases where it might be useful to have a police officer somewhere in the vicinity.
Okay, thank you, Mr. Yang. And same question to you, Mr. Adams.
Thank you so much, and good to be here with Vocal. I would not agree to 100% of the times stating that a police officer should not respond. I strongly believe that the overwhelming number of times that I remember as a police officer not having the need of the police officer being there, but there are a small number of cases where, such as what happened on the train, this person was dealing with mental health crises. He stabbed 4 people on the train. If you send a message that under no circumstance should a police officer respond to any of those cases, sometimes a family member states, my family member is barricade in the room and they are threatening to shoot, or they have a knife and they're threatening to harm someone. So you need to make sure that you have a police officer responding to protect the life of the person who's going through crisis, the family member, and the mental health professional that is attending as well.
Thank you, Mr. Adams. Appreciate the candor. One, I want to apologize. I think that we may be having a technical difficulties where people watching the video, the names are a little swapped. We'll try to address that. But thank y'all for being here. So I'm going to move us on to our first policy discussion. But we're going to introduce the concept around drug policy with a voice from our drug users union. As you're aware, Vocal New York organizes 4 issue-based unions that are made up of people directly impacted by the issues that we work on, which is ultimately how we decide our political platform, and they are the ultimate decision makers in the organization. So Terrell Jones from the Bronx.
Hello, my name is Terrell Jones. I'm a longtime leader of Vocal New York Users Union and the Outreach and Advocacy Program Manager at New York Harm Reduction Educators. The drug war and the overdose crisis have devastated my community. Growing up in the Bronx, I have watched generations of Black, brown, and low-income New York either die of overdose or lose years of their lives to incarceration like I did. At Vocal New York, we believe that every overdose is preventable and that no one should go to jail for using or possessing drugs. We have the tools to prevent overdoses. But now we need the political will to implement these solutions that we know that will work. Take Portugal, for example. They decriminalized all drugs in 2001, and they saw a massive decrease in overdose deaths, along with decrease in new HIV and hepatitis C infections, and more people entering drug treatment. Portugal now has the lowest rate of overdose deaths in Western Europe. And Oregon just did the same. These are the type of bold solutions we need in New York City. For years, legislators have promised us meaningful change, but all we get is more policing and more overdose deaths. We are tired of false promises. We need a mayor that's committed to fundamentally changing the city's approach to drug policy by embracing harm reduction and rejecting decriminalization.
Again, thank you so much to Terrell Jones, who I know for a fact has literally saved many lives with his bare hands through, evidence-based solutions to the overdose crisis across New York City that we've been able to implement, and like folks like New York Harm Reduction Educators. But back to Ms. Morales, the first question we have, where you'll have 60 seconds to answer, goes, decriminalizing possession of small amounts of all drugs is a critical step in ending overdose and replacing criminalization with care. What steps, if any, would you take to decriminalize all drugs in New York City? 60 seconds.
Mm-hmm. Great. So my Green Jobs, Green Food, Green Justice platform begins to speak to the impact of the war on drugs and the over-policing of our communities and criminalization of our communities. There's several things that we call for doing. One is to advocate for the expansion of the 2019 decrim bill and push for the full decriminalization of cannabis, including ceasing the ongoing arrest of Black and Brown New Yorkers. It also calls for collaborating with state officials on legalizing cannabis with a just framework, ensuring that legal cannabis does not, in fact, actually replicate the drug war harm, and supporting proactively an agenda that would reserve a section of the legal market for Black and Brown communities that have been disproportionately harmed so that we too can benefit, and supporting community members through CBOs and investing in the legal system support. I'm going to stop there because I see the time. Okay.
Yeah, actually, a really quick follow-up, Ms. Morales. You talked a lot about, cannabis legalization, but we're asking specifically about decriminalizing small possession of all drugs, including heroin, crack cocaine.
Yes, absolutely. I think that is we need to move towards that in response to the war on drugs. Right. So it's all of those things. You're right. You asked for everything, but all of it. Yeah.
Thank you for that clarification. And then moving to Mr. Adams, same question. 60 seconds.
Thank you so much. And no, I don't support that. Listen, you guys know I'm ex-popo, and so I have a different view of some of these things. Although I was arrested and beat by police officers, I also know the impact of drugs, and I support 100% legalization of marijuana. But anytime we open the shops, we need to make sure that people who were demonized and criminalized, they're able to make their lives whole again, such as cleaning credit reports, having some of the first licensings that's possible. And I also was an ex-number runner as a child. So I know that sometimes they take our professions and they make them legal, then take the profits out of them. But I don't support legalizing crack cocaine. It is devastating when you see what it does. I don't support the legalization of heroin. I don't support the legalization of those hard, serious drugs at all.
Thank you, Mr. Adams. But I do want to note before I go to Mr. Yang that marijuana itself is Schedule number 1 on the federal drug schedule, meaning that it has no medicinal or useful purpose for people. And we got to remember that when we're talking about these drugs, we're not talking about the particular drug, but about people and their lived experiences. So to differentiate marijuana from any other drug is disassociated from the history of drug policy in the United States. But I appreciate your candor again. And to you, Mr. Yang, same question.
The war on drugs has been a war on people. We can all see that. I'm for the total decriminalization of cannabis and marijuana, and we have to make sure that communities of color actually participate in the economic gains that are going to result from its legalization. I'm for the decriminalization of many of these prescription opiates that, frankly, the drug companies have generated billions of dollars of blood money from. And so if you have these drug companies profiting to this level and then turning around, because what happens is a lot of the times people graduate from those prescription drugs to other forms of opiates, and then we're criminalizing that behavior, even though it was induced by this corporate behemoth that made billions of dollars. So to me, this is not so much like a criminal activity problem as it is a public health problem. And if you have a public health problem and you have people who are becoming addicted, again, often because of major corporations spending hundreds of millions of dollars to that effect, then you should be trying to alleviate the negative health outcomes, the loss of life, those addiction, and not be criminalizing this behavior. The goal should be to get people help.
Thank you, Mr. Yang. And just for clarity, you're saying you only believe in legalizing marijuana and not decriminalizing all small possession of all drugs.
No, I would be instructing our DAs not to be prosecuting for, frankly, like personal possession. We need to be getting people that are trying to, frankly, profit and getting other people hooked. But we should not be pursuing people for possession. I'm for legalization of psilocybin mushrooms. And I'm open to the public policy impact of legalizing other substances.
Thank you, Mr. Yang. The best way to prevent the police from going after people for drug possession is to decriminalize those drugs. But we're going to move on to our next question, popping back over to Ms. Morales. Let me just set it up for you here. Overdose prevention centers are places where people can use pre-obtained drugs under the supervision of trained professionals who can intervene in case of an overdose and link people to services and care. There are more than 100 overdose prevention centers across the planet, and peer-reviewed studies have proven their public health effectiveness. Will you direct the Department of Health to partner to implement overdose prevention centers in your first year in office? You have 30 seconds.
Yes, absolutely. Listen, the war on drugs decimated our communities. And in order for us to truly move forward, to move away from the criminalization of poverty and the criminalization of existing while Black, we need to prioritize care and the preservation of Black lives. And that means moving away from the dehumanization of our people and providing them with the support that they need to heal. That includes overdose prevention centers that provide a safe space for us while building trust and relationships so people can get connected to the care that they need.
Thank you. And Mr. Adams, same question.
Yes, love it. Love the idea of it. And we should go one step further, not only having these centers, but to do some of the things I did around the shower bus, where we had a shower bus, first of its kind in New York City, to allow people to, right outside that center, should be those who are homeless, to be able to take a shower. And also wraparound resources. Now that we have people who are trying to medicate themselves from some of the pain that they're experiencing, let's be there to give them the wraparound resources that they need. Let's use these opportunities of engagement to take people where they ought to be.
Thank you, Mr. Adams. Mr. Yang, same question on overdose prevention centers.
Yes, I advocated for overdose prevention centers nationally because of the data that you just cited, which is that they save lives. The purpose of everything we do should be to save lives. And I know that to some extent, this has been a political issue because people are not excited about having an overdose prevention center in their neighborhood, but they wouldn't object to having a hospital in their neighborhood. And this, to me, has the exact same purpose, which is to keep people alive, make sure that brothers and sisters and mothers and fathers can see their families again.
Thank you, Mr. Yang. Thank all three of you for those answers. I'm going to quickly move us forward. We're running a little bit out of time, but these are two quick yes or no response questions. Back to Dianne first. Harm reduction programs in New York City provide free services like syringe exchange, naloxone, and care coordination, hepatitis C testing, and many other health and wellness services to people who use drugs. Will you commit to doubling the New York City Department of Health's funding for harm reduction programs and interventions in your first term?
This is yes or no?
Yes.
Yes.
Thank you, Ms. Morales. Mr. Adams?
Heck yes.
And Mr. Yang?
Yes, this is where we should be spending our money.
Thank you. Second question, again, back to Dianne. Despite growing recognition that the war on drugs has failed, New York City continues to be the only city in the nation with a special narcotics prosecutor, an office dedicated solely to prosecuting drug crimes. The office was created in 1971, the same year President Nixon declared the war on drugs. Do you support eliminating the special narcotics prosecutor?
Yes.
Mr. Adams?
I can't answer yes or no to that.
You can answer.
I cannot answer yes or no to that because there's caveat to it, and I don't want to be misquoted.
So you don't support ending a special prosecutor specifically for drug users? Or drug
your question was yes or no, and I say I can't answer yes or no to that because there's too many caveats. Because there is a yes and there's a no response to that for me.
Noted. Thank you, Mr. Adams. And Mr. Yang?
Yes, the war on drugs has not worked. Having this position just means that you're furthering a failed policy.
Okay, so thank you all three for that. Concludes our drug policy discussion. So I'm going to move us forward to talk about homelessness. And first, we're going to hear from our homeless union leader, Milton Perez, who has been homeless for over 5 years in New York City.
Hello, my name is Milton Perez. I am a native of the Bronx, Puerto Rico. I am currently a guest here in Brooklyn, Brownsville, East New York. Mainly, I've been in the shelter system over 5 years. Around this time last year, in 2020, members of Vocal New York came to the shelter, and from them, we learned more about the politics of homelessness in the shelter system. In my experience, I'm mostly known the business of shelters. So business with a customer, meaning us, the shelter residents, always wrong. It's a business in which most businesses run 9 to 5, and in the shelter system, from 9 to 5, they want you out of the shelter. But most of the staff is working, whether it's the caseworkers, housing specialists, and such. During my time, I've seen nothing but barriers being put in through HRA, DHS, and various other agencies. So people are basically running around back and forth, not knowing what to do, receiving little to no information, and just mostly being confused, being lied about. So my question to the mayoral candidate is what are you and your administration going to do to ensure that all these agencies, HRA, DHS, and such, work together with the shelter residents so that we can move forward and end this problem of homelessness that's been around for decades now? Thank you so much.
Whew, thank you, Milton, and we deeply appreciate his leadership in our homeless union. And just so you guys know, we're running really short on time, and we got two sections, homelessness and decarceration. So I'm going to ask the questions real quick, and if you could be on time as much as possible, that'd be great. So starting again with Dianne, over 78,000 people are living in shelters or on the streets across New York City. Thousands more are sleeping on couches or living in residential drug treatment programs, three-quarter houses, or even jail. In your first year in office, what policies would you implement to put New York City on the path to end homelessness? 60 seconds.
So within the first 100 days of my administration, I would make a commitment to providing more secure and guaranteed pathways to end homelessness and provide permanent housing for everybody. That includes converting any existing spaces that we could get our hands on as the city in order to convert them into permanent housing. It includes appointing a deputy mayor who will be responsible for coordinating and facilitating this issue. It includes shifting the $3 billion annual shelter budget towards providing and supporting permanent housing, and advocating to ensure that we are increasing the rental assistance and monetary support system for all people in the homeless system right now.
Thank you, Ms. Morales. Mr. Adams.
Yeah, thank you. First of all, homelessness falls into three different categories: children and families, single adults, and mental health crises. And so we need to attack all three together. I think it's extremely important to really coordinate our city, several agencies that deal with housing, because the way to deal with homelessness is to have permanent housing. HBD, HRA, NYCHA, DOB, one deputy mayor in charge of all of those agencies. Second, let's deal with the street homelessness. I'm going to invest in programs like Fountain House, where we give the wraparound services so that we don't have our homeless men and women that are living on the street, afraid to go into shelters, have to experience that, and they will get the support services they need. Then we're going to prevent homelessness. We reinstitute the Advantage type program to allow people who can't meet their rents, give them the support they need so they can stay in their permanent housing.
Thank you, Mr. Adams. Mr. Yang?
Number one, we have to keep the crisis from growing. We need to extend the eviction moratorium indefinitely until people are back on their feet and able to pay rent. Now, for the shelter system itself, the stays have gotten longer because of a number of problems. We need to expand supportive housing, which right now is bottlenecked. We need to double or more the number of safe haven beds, which frankly help both the sheltering population and the street homelessness population. We need to reverse the decline of psych beds in New York City, which have declined 14% when the needs have skyrocketed. We need to expand the value of vouchers to actually be market rate so that people can leave the sheltering system. And then to reduce street homelessness, we're going to have to have a more assertive standard of intervention to try and get people the care that they need to get off the street and into, frankly, like more stable environments that include mental health resources, substance abuse resources, and more. This is a solvable problem. We can make it better. We are spending billions of dollars right now in an inefficient and inhumane way that can be dramatically improved with the right leadership.
Thank you, Mr. Yang. And back to Ms. Morales. In order to meet the immediate needs of the most vulnerable individuals sleeping on the streets, the city must provide an adequate supply of emergency on-demand housing called safe havens, including for people who use drugs and are struggling with unmet mental health needs. If elected, would you guarantee access to non-congregate safe haven beds for every person that is living on the streets and needs one in the first year of your administration? 30 seconds, please.
Yes, when I talk about housing as a human right and committing to housing for all, it means especially those that are on the margins and struggling the most, not instead of those or not except those. So absolutely, we need to make sure that we're prioritizing housing and stability for everyone, period.
Thank you, Ms. Morales. Mr. Adams?
Yes, without a doubt. But also we should do something that a federal government has in what's called halfway houses when people leave correctional facilities. We're going to have thousands of young men and women who are leaving. They need to go into houses so they can transition back in society. So yes to your question, but I will go even further in that.
Thank you, Mr. Adams. Mr. Yang?
I 100% agree with his goal. But the reason why I can't say yes within the first 100 days or yes within the first year is simply because we have about 1,200 safe haven beds right now, and you're talking about a need for somewhere between 18 and 30,000. So the question is, can we grow from 1,200 to 20,000 or 30,000 within the first 100 days? I would certainly love to make that happen because we need those beds. But I do want to be realistic that it's hard to go from 1,200 to 20,000 in the time frame that you've described, though that should 100% be the goal. I've committed to more than doubling the capacity, and we need to go much further.
Thank you for that, Mr. Yang. But I will note that the homelessness crisis in New York State, in New York City, is greater than it was during the Great Depression. So we're going to have a city government meet the need of the crisis.
I totally agree. I just wanted to let people know what the actual numbers in that time frame would look like.
Okay, so I'm going to move us on to our last question on homelessness, and then we're going to move to decarceration. And we're going to start with Dianne Morales. 16 and 17-year-olds just won the right to shelter in the DYCD system. If you become mayor, will you grant the right to youth shelter to all youth up to age 25? Yes or no?
Yes, I've actually been advocating for that since 2006. So absolutely, yes.
Thank you. Mr. Adams?
Yeah, yes.
And Mr. Yang?
Yes, of course.
Thank you. So we're going to move on to our conversation around decarceration and defund the NYPD, first with a video from our leader, Carl Stubbs.
My name is Mr. Carl Stubbs, and I am a leader at Vocal New York. The first time I was locked up, I was 12 years old and sent to Spofford Youth House in the Bronx. I spent the next 20 years going in and out of jail, mostly committing crimes because I couldn't find a job and needed a way to provide for my family. Today, I am 69 years old, still living in poverty. I wonder what my life would be like if the money used to arrest me and lock me up was instead used to support my education and help me get a job. I don't want the next generation to go through what I went through. There always seems to be money for police, but never any money for housing or education or good paying jobs. I want to live in a beautiful neighborhood where everyone has what they need to survive. We need the next mayor to cut the NYPD's budget and invest in communities.
Sweet. Thank you again to Carl Stubbs. Starting with Dianne Morales again. Every candidate has expressed a commitment to reduce both the NYPD budget and the scope of the work that the NYPD is responsible for. We want to hear specifics. How much would you reduce the NYPD budget by, and how exactly would that money be used to address social problems and make our communities safer and healthier? 60 seconds.
So I have called for the reduction of the NYPD budget in year one by $3 billion. I think that we need to stop divesting from our communities and start reinvesting in our communities. And that means investing in supportive services, in counseling and medical services. I've called for the creation of a community first responders department that would act as part of a larger ecosystem to help connect people to the services and programs that they need, mental health, medical, housing, etc. Because we know that creating safe communities actually means creating communities that have access to these resources. And that's what we need to be investing in rather than policing. And that's what I've committed to.
Thank you, Ms.
Do I have a whole 30 seconds? Okay.
Well, we're actually running low on time. So if you don't want to add anything, that's fine.
I mean, I could keep going. But you guys have said that. You guys have talked about what is needed in communities to make them safe. And I'm 100% behind the agenda, and I think that that's what we need to be investing in. So I'll just leave it at that.
Thank you. Mr. Adams?
Listen, I believe in what Vocal is doing. That's why I supported financially your Gowanus Center. And that story you just was mentioned resonates with me because, I was arrested at 15. I was in Spofford. I was up there today, and I saw that sign, and it brought back memories of what it was like in a juvenile detention facility. I can't give you a dollar amount of how much I'm going to take from the police budget. But I'm going to tell you, I'm going to deal with the $400 million in overtime. I'm going to deal with the civilianization to get police officers out of those civilian assignments. I'm going to change the ecosystem of public safety and put money into things like foster care, aging out at 21. I want them to age out at 26. I'm going to reinvest the militarization of police dollars that are buying tanks and weapons that can shoot down planes. We don't need those stuff, but I am committed to make sure we run all our agencies efficiently. But the exact dollar amount, I cannot give you that.
Thank you, Mr. Adams, and we appreciate your support so that we can continue saving lives in Brooklyn to make sure that people aren't dropping dead in the streets. Mr. Yang, same question.
I think the NYPD and the criminal justice system are two sides of the same coin. And if you look at the excesses, they're on both sides. I think it may have come up a little bit earlier, maybe even in that questionnaire, but we're spending over $300,000 per inmate per year, which is insane. Like, we could be spending that money much more effectively on mental health resources and substance abuse resources and education, and on and on. So we need to get smarter as well as more human and humane about the way we're spending this money. Someone told me today that there are more Department of Corrections officers on Rikers than there are inmates at this point, like, which struck me as just like absolutely indicative of the excesses that are running throughout our system. My goal is to take a significant percentage. I want to beat Los Angeles, because who's better than Los Angeles but New York City, in terms of channeling. They did 10%. I think we can do significantly better than that of both NYPD and the criminal justice system towards the services we know our communities need.
Thank you, Mr. Yang. We're going to change our last question to a yes, no, because we have exactly 1 minute. Do you support the plan to close Rikers and build 4 new jails? Dianne Morales.
And build 4 new jails? No.
You support the plan to close Rikers, but you don't want to build 4 new jails.
That's correct.
Thank you. Mr. Adams.
Yes.
You want to close Rikers, but you don't want to build 4 new jails.
No, I support closing Rikers, and I support building a modified version of new jails.
Thank you, Mr. Adams. Mr. Yang.
Yes, close Rikers, and yes to modified version of new jails. I think we can do it better and smarter than the current plans. The current plans seem excessive.
Thank you. Thank you. So that actually concludes our last session. We deeply, deeply appreciate all of you and everyone that was able to join us today for this forum.
I just want to say, my friend, you have a future as an MC, an auctioneer, anything in that milieu, because you're very talented.
Thank you. I deeply appreciate that, Mr. Yang.
I think you have a future in being a mayor candidate. Think higher.
That too. I wanted him to think higher than mayoral candidate, Eric.
I'm just trying to live in a city without police and prisons. But thank y'all so much. And thank you, Dianne Morales.
Thanks, Joanza. Have a good one.
Y'all take care.
Bye, Joanza. Bye, everybody.
Bye.
See you later.